Hello friends, we are discussing about a case of hemorrhagic stroke today. How is the clinical presentation and all. Now coming to presentation, a 40-year-old male who is a known hypertensive diagnosed 6 months ago who is not on any treatment came to emergency department with chief complaint of weakness of left upper limb and left lower limb and deviation of angle of mouth to the right side. By this information, we can diagnose it as cerebrovascular accident or stroke with left facial nerve involvement, but we can't say upper motor or lower motor neuron until examination. Okay, then coming to the examination. On examination, patient is conscious, coherent, and his blood pressure is 240 by 120, pulse is 86, and personal history is known alcoholic and smoker. Now, what is our diagnosis? By looking at his BP on history, we can now can call it as or can think more about hemorrhagic stroke. But it can happen in ischemic stroke also, that raised blood pressure. But now it is more in favor of hemorrhagic stroke. Then coming to our examination, tone in right upper limb and power is 5 by 5 normal. In left upper limb, tone is increased and power upper limb is 2 by 5 and lower limb is 3 by 5. Deep tendon reflex is +3. In right is +2 and plantar is extensor. And facial nerve, coming to facial nerve, it is UMN type of facial palsy, i.e. only involved lower part of face, sparing the upper part. So that is UMN facial palsy. Then our plan is to get CT brain, and at this is the CT brain at the time of admission. We can see the hyperdensities in the CT brain. So the hyperdensities in CT brain suggests it is hemorrhage. And the second circle one is intraventricular extension, and third one is in the CT brain the hemorrhage is of the edges is variegated, or edges are looking like edges, so there is increased chance of bleeding. So we admitted in the ICU and given treatment. And we can see in the fourth point there is enlargement of temporal horns. This is due to raised intracranial tension. So our treatment was to control BP. We have given IV antihypertensive like labetalol. To control increase the rise ICT, we have given mannitol and head and elevation, etc. Then the repeat CT after 48 hours, that is after 72 third day, we can the rounded portion we can see the hemorrhage is decreased, and we can see the edge of the hemorrhage is now smooth. So now we can say there is no further bleed or no further risk of bleeding. Then the circular portion is now the enlarged temporal horn is size is decreased. So we can say the ICT was decreased. So the patient was discharged after 10 days of ICU care. Then we asked for follow-up. The patient was significantly improved, then we are discharged. In the follow-up, we have given hypertension medication, physiotherapy, and statin and risk factor modification. So this is how the patient with CVA hemorrhagic stroke